we're now going to go on to consent. And so there are three components of consent. So you have voluntary, informed, and competent. And so it's basically like I mentioned before, where as a patient, you should never ever feel like the dentist is forcing you to make a decision. Actually, not even a dentist, but a hygienist or a nurse. They should never, as a patient, you should never feel like you're being forced into a decision to do a specific procedure as opposed to another. And you really have to be able to give the choice to your patient. Otherwise, there can be a lot of legal issues that isn't very talked about in dentistry. As in terms of as a prospective student, you probably don't hear about it a lot, but there can be a lot of legal issues if you don't follow the GDC guidelines, and that involves making sure that you're not pressuring the patient into a decision. And as I mentioned before, making informed consent is extremely important in dentistry, and you should be able to highlight every single possible threat and benefit of the procedure to your patient. And this has to be done with good communication. If you feel like your patient isn't understanding what you're saying, you need to find a way that they can understand. Whether that means that you can have non-verbal and verbal communication. And so that's something that I did talk about in my interview. So non-verbal communication is talking with your hands, using symbols and signs to be able to demonstrate whatever you're trying to say. Not every single person will be able to speak English. Not everyone will be able to, some people might be hard of hearing. And so that's why being able to have good communication as a practitioner is extremely important in being able to ensure that your patient makes informed consent. And competence is extremely important because people with language barriers can often pretend or say that they understand a situation when they don't. My mum can't really speak English very well, and so I have to go to a lot of appointments with her. But if I weren't there, then I feel like she would just nod and agree. But it's really important as a dentist and as a healthcare professional to be able to understand that and be able to recognize, is this patient actually understanding what I'm saying? Can they actually take away this information from the appointment and actually be able to, put it in their own words? One thing that we get taught to do is to be able to see if the patient understands the information you're giving them, is asking them to say it back to you in their own words. And that way they can weigh up their options and they can communicate it back to you. And by being able to see that they can communicate back to you is a very, very good way of understanding whether they are competent enough to make a decision themselves, and therefore can make an informed and voluntary consent. So we're going to go through the times when it is hard to go through to obtain consent.
Want me to do this?
Yeah, you can do that.
Yeah. So as Joanna mentioned, you might be placed in situations where it's hard to get consent. You might have a language barrier, you might have a child, you might have a difficult situation, and a lot of ethics stuff that you might see in situational judgment in UCAT, where, for example, you might have a parent that is saying one thing, but the child wants something different, and your patient is the child. What do you do in that situation? So you've got Fraser guidelines and Gillick's principles, which exist to sort of overcome these problems. So it states that anyone that's over the age of 16 can be treated as adults, but they can't refuse treatment. So they can give consent, but they can't refuse it. So if it's something that you need to do on behalf of the patient and in their best interest, they cannot refuse it until they're sort of considered of an adult's age, which is above the age of 18. Children younger than 16 can also give consent if they're competent. And this sort of ties into the types of consent that you have. So having informed consent and making sure that your patient understands what it is that they are going to be treated for and what the treatment options are. So if your patient is competent enough to making a sound decision, they can do so. But at the same time, they can't refuse treatment. So that way you're always working in the best interest of your patient, because certain treatments, if refused, will harm the patient more than it would do good. And then their ability to consent and refuse is also judged by procedure. So certain procedures and certain treatment plans have a lot of barriers and hurdles that you need to jump through before even obtaining consent. A lot of things such as transplants or even dental related, doing an extraction, you need written consent. Whereas things such as a scale and polish or even triaging and getting a history and examination from a patient, you just need verbal consent in that sense. which is then documented in your notes. So depending on the types of treatments that you have, you would have written consent and verbal consent at the same time. If you have an unconscious patient, it does get quite tricky. And I think in my UCAT, I had a lot of scenarios and situation judgment about this, but I was never asked about this in interview. But they may have beforehand refused or accepted treatment. So you need to make sure that you check your notes beforehand and keep up to date with what the patients have been saying as well. They also might have nominated someone to act in their best interest, which should always be documented in your notes. So always look at that as well. And if not, you can talk to the family and talk to your dental team to make a decision depending on the best interests of the patient. So if you do it collectively, it works better because the more people that are involved, for example, your team, the harder it is to pin it on you as a dentist. And when it does come to difficult situations like this, you do have to think about the legal aspect, the off chance that you might get sued and taken to court. Having spoken to your team and coming towards a collective decision can help, because it shows that it wasn't an impulse decision, one, and two, you've taken time to sort of group all the expertise that you have around you to make sure that the decision that you've made is sound. And finally, illness can make a patient confused or incapable of giving consent. And it is your role as a dentist, as a practitioner, to make sure you're looking out for these things. So if the patient isn't communicating effectively or at all, it should hint to you that they might not be competent enough or responsive enough to give valid consent. And these are things that you should highlight, not only to the patient, to your team, and also in your notes, just in case it backfires to you. Yeah, I think that's it for consent.
Yeah. So I'll read it out and then you can go through it.
Yeah, go.
Okay.